Last summer I had an experience that was, I would call, not very favorable.
With her primary care doctor out of town and suffering severe arm pain, Joan Schilke spent $3,600 and a day of time between a walk-in clinic and a hospital ER.
They sent me home with some ibuprofen and said, "Oh, you're not having a heart attack."
By the next day, Joan's primary care doctor was back.
She took one look at my arm and she said, "Well, you have shingles."
It was a simple $60 diagnosis.
About $2,800 or so I paid out of pocket.
Such stories happen daily in our complex, confusing healthcare system. Procedures seem to take precedence over preventive care. We worry about our medical bills, and as patients, often wait until we're sick enough to see a doctor.
Yeah, if you wait until you need acute care to see a doctor, the doctor's going to pay attention to that acute care. But you may miss an opportunity to get some preventive care.
The problem is, our current healthcare system is broken. Our doctors are paid only for the most expensive things they do, like face-to-face visits and medical procedures. Our system doesn't emphasize preventive care. Family physicians know an ounce of prevention is worth a pound of cure, but not in our healthcare system. Because so many of us wait too long to see doctors, complications force us to see more specialists or go to emergency rooms, and all of this costs a lot more money. It's no wonder healthcare costs have gone into orbit. We're spending $2 trillion annually on healthcare, and we're not even that healthy. We're spending the money on treating illnesses, not helping people stay healthy. Something needs to change. What if you could have a primary care doctor who really knows you, someone who works with a team of medical professionals taking care of you most of your life, people who know all about you, who listen to you, who coordinate all of your care, even when you do have to see a specialist? What if you could have a medical place to call home, someplace convenient where you could actually call your doctor on the phone, see your doctor the same day you got sick, find resources for self-help when that's appropriate? I mean, how complicated would that be?
We're all trying to provide the best possible care we can.
At the individual doctor level, there are many of us that try to do this, but it's hard. The system stacks up against us.
The World Health Organization ranks our healthcare system 37th. We're barely better than Cuba. 2,200 family physicians here in Wisconsin and thousands nationwide, plus a growing list of U.S. corporations, know the current healthcare system must change.
We've developed a system in the United States where people go to a specialist who takes care of a particular system of their body or a particular disease and doesn't always look at the entire person.
A concept called the patient-centered medical home has the power to fix our broken system, and it's creating a buzz nationwide.
Well, the idea of a medical home has great appeal because it's an organizing concept.
The patient-centered medical home has a whole patient approach to it. In the patient-centered medical home, the team in that home, led by a physician, is going to care for the entire patient.
The concept is kind of like it takes a village to raise a child. It takes a team of people to really provide great care.
One of the ways I think about it is the analogy of the old television story Cheers, where everybody knows your name.
In the patient-centered medical home, care is coordinated by one physician leading a team of medical professionals. Collectively, they take responsibility for continuous, comprehensive care through all stages of life, from cradle to grave. Care is preventive, integrated, well-organized. It's characterized by effective communication and based on continuous healing relationships. Care is also coordinated across all aspects of a patient's life, including the healthcare system. Patients have greater, faster access to their physicians and are also empowered with resources to care for themselves. Patient-centered medical homes also promote listening to patients.
It didn't feel like the doctors really listened.
The person that's going to define how well I'm meeting their needs is the patient.
We're learning that we can't do it all ourselves as a physician or a nurse practitioner or a physician's assistant. We need to work within a team of people whose main goal is to reach out and understand what that community we serve needs to heal.
Where the patient-centered medical home concept is taking hold, it is achieving the best of both worlds, lower healthcare costs and better healthcare outcomes.
Dr. Rakel has been able to, take the time to listen to understand me, to guide me, to other areas that have been helpful in helping me from a medical standpoint, but still being that central spot to come back to and provide me with a base.
Study after study show that patients with an ongoing continuous relationship with a family or other primary care physician receive better care. In the U.S., adults with a primary care physician have 33% lower health care costs, spend less time in hospitals, and are 19% less likely to die from their conditions than those treated by a specialist. Patient-centered medical homes combine the improved health care of these relationships with improved health care practices to produce enhanced health care outcomes and increased cost savings. It's estimated that if everyone had a medical home, health care costs would drop 5.5%, saving Americans $67 billion yearly in health care expenses. That's more than $200 for every man, woman, and child in the country. Major corporations, insurers, consumer groups, and primary care doctors are embracing the patient-centered medical home. Many states and localities are incorporating the medical home concept into their funded health care programs. In Wisconsin, practices like this and others are turning to the patient-centered medical home concept. The difference is apparent. Are you happier?
I can't, begin to explain how much happier and much better it is for me.
Two patients, two entirely different outcomes. The difference is the patient-centered medical home concept. It's not a pipe dream. We can lower the cost of health care and make all of us healthier.